Hi, hello everybody. Welcome back to another session of One Question a Day. The question that we are going to discuss is the maxillary sinus or the antrum of Highmore. A lot of sub-questions has been asked in the past university question paper on the maxillary sinus. Could be due to from the development, from the location, or histology, or the functions of maxillary sinus. Today, we will see the entire concept, how to write a short notes or an essay if the maxillary sinus or antrum of Highmore has been asked in the university exams. The definition is maxillary sinus anatomically is a pneumatic or air-filled space present in the body of maxilla. Is a physiological, is part of the anatomical. It's not a pathological. It is not a pathological. It is a pneumatic air-filled space present in the body of the maxilla. And there is a sinus in each side of the nose along inside the body of the maxilla. In a series, how does it develop? In a series of morphogenetic events occurring during the horizontal shift in the palatal cells, wherein after a period of time in 8 weeks, 7 to 8 weeks, there is a fusion of palatine cells occurring, and that later fuses with the nasal subsystem. And it is during this process that the maxillary sinus is initiated. During maxillary sinus formation, changes occurs in the lateral wall of nose, where it subsequently undergoes numerous foldings called as concave. There are three concave appears on the lateral wall of the nose. And that divides or borders into three meatus, named accordingly superior, inferior, and middle. The superior and inferior meatus remain shallow, whereas the middle meatus expand in the inferior direction, occupying nearly the internal entire surface of the maxilla to form this maxillary sinus. At birth, maxillary sinus is not so big, it is just rudimentary. But as age progresses, maxillary sinus enlarges. The anomalies associated with development is agenesis, where the maxillary sinus is not formed, aplasia, where it is very rudimentary, very small, hypoplasia is underdevelopment, supernumerary, more than one completely separated sinus appearing on the same side of the nose is called as supernumerary or accessory. Structure-wise, maxillary sinus is a tilted form of four-sided pyramid with the apex lying along the tip of your nose. The other four sides are the base of your orbit, right? The lateral wall of the nose and front. Because the base is very thin, sometimes there will be a lot of perforations present. Most oftenly along the middle nasal meatus of the lateral wall, and these are called as the ostiums. It is an opening through which maxillary sinus opens into the lateral nasal wall. The ostium is about 3 to 6 millimeters in size, and it is often present in the groove called as hiatus semilunaris. Recesses. Maxillary sinus extends beyond its boundary is called as the recess. Maxillary sinus that extends beyond boundaries is called as recess. Could be when it extends into the alveolar ridge, it is called as alveolar recess. When it proceeds into the zygoma, it is called as zygoma recess. When it is going towards the frontal recess, or palatal side, it is called as palatal recess. The significance here is sometimes in this alveolar recess, when the sinus dips, the sinus, especially with respect to the maxillary palatal roots, the maxillary sinus may be in touching the palatal root, or sometimes if the palatal roots are long enough, they may penetrate these recesses. And when you happen to extract or perform a procedure, the maxillary sinus will be automatically involved, or a oroantral fistula will be formed. Oroantral fistula will be formed, and that will be pathological because it will introduce foreign material into the sinus. So adequate care has to be taken before extraction of long rooted teeth such as palatal root of maxillary molars, or sometimes even your maxillary canines may be in close proximity with this sinus recesses. If there is a pathology in this root, they may directly involve the sinus and may produce maxillary sinusitis of odontogenic origin, meaning sinusitis inflammation triggered by tooth-related infection. Histology, the most important part. It is lined by pseudo-stratified ciliated, not stratified, but as pseudo-stratified ciliated columnar epithelium. Columnar epithelium, pseudo-stratified ciliated columnar epithelium that has three distinct layers. The first is the epithelial layer, followed by a basal lamina and subepithelial layer. A diagrammatic representation. Mark the nucleus, please. Epithelium, there are three types of cells. Ciliated columnar, which are the numerous cells of the epithelium with a prominent cilia to clear off the mucus. Each cilia is made up of 9 plus 1 central microtubules. The function of cilia is to move the thick mucus or clear the bacterial that is entrapped by beating movement, moves the mucus from the sinus into the nasal cavity. The basal body attaches to the cilia to the cell. And basal cells, few basal cells are present, they are non-ciliated. Goblet cells are those that are responsible to produce mucus, which is a characteristic feature. When inflamed, they produce copious amount of mucus, which is a protective mechanism. Secretory cells. These globulate cells are the secretory cells of the maxillary sinus. They have a prominent nucleus. If they are triggered, they will have sufficient number of rough endoplasmic reticulum, otherwise smooth endoplasmic reticulum, prominent Golgi apparatus, and lot of secretional granules, which secretes the mucus via exocytosis, a phenomenon of throwing around. The subepithelium, you have a lot of subepithelial glands, which are nothing but could be serous cells, mucous cells, or myoepithelial cells. Their function is to secrete mucus. The most important part is the functions of maxillary sinus. Because they are a hollow structure, they add resonance to the voice. Because they are hollow structure, they decrease the weight of the skull. In birds and avian mammals, this increases the weight of the skull so that flying is easy. They moisten the inspired air so that when it goes to the lung, it does not hurt. They filter the debris because by the presence of cilia. They provide air padding and insulation to the brain so that the temperature remains a little bit less than the core temperature of the human body. They, by their presence, protect the brain from mechanical trauma by absorbing the shock. Also, their secretions has antibacterial activity, and because they have a lot of lysozymes, traumatic injury to the area because they are prominent in the face could lead to fracture. Foreign body entry through the oral antral fistula is possible. Hematoma formation in the area can be very grievous because it can be transmitted via the cavernous sinus thrombosis. The inflammatory changes associated with infection, bacterial or viral, is sinusitis. Very common misnomer, very commonly mistaken with odontogenic infection of the maxillary tooth. Developmental abnormalities could be agenesis or superior sinus. Sometimes surgical mucocils or mucocils may be formed from the lining epithelium. Neoplasms are also not infrequent in the region, especially like aplastic leukemia or some other lot of tumors and cysts occurs. Metabolic diseases such as Paget's disease, fibrous dysplasia can involve the maxilla and thereby the sinus. Oroantral fistula. As we said, a damage to the tooth structures with long roots, because this long root tooth act as a natural weak point. So any trauma could precipitate this oroantral fistula, or odontogenic infections with the association with the tooth, like maxillary canines or your palatal root of maxillary canines during extractions, or a pathological process such as periapical lesions can pass on the infection from the tooth apex to the maxillary sinus. A pathological cavity or a path or a fistula may be created, which is called as oroantral fistula. So these are the applied changes. With that, we come to an end on the discussion on maxillary sinus. Stay connected with our channel for more questions in the in-between. Study incrementally. Happy learning.